These three medications, Viagra, Levitra, Cialis, initially approved in 1998, are a class of compounds that one cannot distinguish by their chemical formulation. They are PDE5 inhibitors or phosphodiesterase type 5 inhibitors. And while there are subtle differences, Viagra and Levitra are shorter acting. In contrast, Cialis is a longer acting medication. These three medications, Viagra, Levitra, Cialis, help augment a natural erection. Indeed, there are subtle differences. Viagra and Levitra are classically short-acting. Cialis is the longer-acting medication. These medications, Viagra and Levitra, can act in about 30 minutes. In contrast, to get appropriate blood levels, Cialis may take up to 2 hours. Initially, I recommend that these medications should be avoided with any meals. Viagra and Levitra are medications that may be affected with a high-fat meal within 30 to 60 minutes. Cialis, on the other hand, based on studies, shows that there are no significant food interactions. Generally, these medications do not affect patients with respect to their nausea. However, Viagra and Levitra should be avoided because their absorption with a high-fat meal may be impaired 30 to 60 minutes after a meal. Generally, these medications do not result in nausea. However, their absorption may be affected with a high-fat meal. This has been particularly seen in the short-acting PDE5 inhibitors, Viagra and Levitra. The short-acting PDE5 inhibitors, Viagra and Levitra, have a window between 4 to 12 hours. Cialis, on the other hand, is a medication which in Paris is known as Le Weekend and can take effect for 24 to 36 hours. These PDE5 inhibitors augment or promote your natural erection. These medications, while they have a window or a therapeutic window of opportunity, essentially does not mean that your erection persists, because after climax, the erection is going to fade out.